I'm Christina Tamelio with CP24. Please go ahead.
Hi, Christina.
Hi, Premier. Hi, everyone. Want to know what the difference really is here between a stay-at-home order and a curfew, and in terms of enforcement? Because, what are places in these jurisdictions across the province supposed to do? If someone's out and about and says, oh, I'm going to exercise, oh, I'm going to the grocery store, there's no way to prove that otherwise. Also, I want to point out, these enforcement measures have been in place for months. New Year's Eve at Nathan Phillips Square here in Toronto, about 350 people gathered. Toronto police chose not to ticket anyone. So these measures have already been around. Why are you so confident that now enforcement is going to work, and how will it work?
Well, I'll start off before I send to the Solicitor General. I'll start off the differentiating between a curfew and a stay-at-home order. We're asking people, and we need help. Granted, I'll give you. We're close to 15 million people, and we've never been strong on and ever applying a police state. A curfew is you aren't leaving your house. Simple as that. After 8 o'clock, you see what's happening in Quebec. The streets are empty. I've never been in favor of a curfew, and I'm going to tell you the reason why I've never been in favor of a curfew. And that's a hard lockdown. Cars aren't driving around, nothing at all, because I believe in the people of Ontario. And as soon as you tell the people of Ontario you've lost trust and we're going to have police chasing you down the street when you're driving, that's it. It's game over. You might as well throw in the white flag. Everyone's been working together for the last 10, 11 months, going through a tremendous strain on everyone. But the last thing I've ever believed in, is having a curfew that when you pull out of your driveway after 8 o'clock, the police are chasing you down the street. I just do not believe in that. I'll pass it over to the Solicitor General.
So one of the big changes with the stay-at-home order is actually allowing and empowering provincial offences officers, most commonly bylaw enforcement officers, to also issue tickets and to disperse crowds of larger than 5 if they're not in the same household. There are many things that we can do as a government, but at the end of the day, people have to understand how serious this is and how by staying home, it will in fact save lives. That's at the core of everything we're doing. If people comply with that, if people understand how that will ultimately save their loved ones, their family members, their grandparents, then we have achieved a goal that is going to allow us to beat COVID-19 until we can get sufficient vaccines to vaccinate all Ontarians who wish to do so. Thank you.
Follow-up?
Yeah,
I want to
Christina.
ask you about reduced hours for places like grocery stores and other similar stores. Are you concerned that will just result in more people heading out and shopping during condensed store hours? Because most of these stores, like Costco, for example, already closes at 8 p.m. Someone wrote to me saying, I often go to the grocery store late so I can avoid crowds and limit my exposure to others. And they're also concerned about limited hours is not helpful to essential workers who work shifts.
Well, all retail stores and big box stores, and I want to talk again for a second about big box stores. I'm going to come down on them like an 800-pound gorilla. If they aren't following the protocols, they aren't following the guidelines, if they don't have 50% only in the stores, there's going to be consequences for them. And I'm not going to mess around with these big box stores. There's a purpose. People should go in, get their stuff, and come home. Going back to what you were saying about a curfew, we aren't telling people if they have to walk their dog around the block. As Dr. Williams said, walk your dog. If you need to stretch your legs, walk around the block. All we're asking is for cooperation for the people. Please stay home. That's what we're asking for. I'll pass it over to the Minister of Health.
Well, it is
is really important to reduce the transmission, to reduce mobility. And the less you're out, the less you can transmit the virus or receive the virus. So that's going to be really vital for us going forward. But with respect to your question about the stores, any of the essential stores that sell groceries, pharmacies, convenience stores, gas stations, and so on, they can stay open to their regular hours. It's only the purveyors of non-essential goods that will be held to the 8 p.m. guideline and will be required to be closed by that point.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. I think probably a lot of people are walking at home right now and wondering what is essential.
I'm sorry, you broke up, Rob.
Rob, your phone's kind of cut out there.
Maybe we can come back.
We'll go to the next question.
Thank you. The next question comes from Travis Damrosch with Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. Good to talk to you.
Good to talk to you, too.
Listen, I think most people in this province would agree that Ontario is not in a good place right now. But when asked if the government bears any responsibility for where we are right now, Dr. Yaffe said yesterday it's the virus's fault, and then she went on to talk about Ontario's actions. You just said as well that it's one thing to blame the virus, but are you telling the people of Ontario that where we are right now is only the result of their behavior and not because of government inaction? I mean, there have been calls for further restrictions for some time now, for more enforcement. So does the government bear any responsibility here?
Travis, from day one, I take all responsibility. This lands on me, I take full responsibility. I think all the people of the province have worked well together. We've worked collaboratively with the federal government, with the municipal government, and obviously our provincial government. We've worked collaboratively with all other provinces. Everyone is working their back off non-stop. We need to secure our hospitals, secure our ICU. We have to make sure that people are following the guidelines, and that's what we're going to continue to do. So if there's any mishaps, I'll take the full responsibility. But I know one thing, Travis, we are doing everything in our power, everything, day in, day out, sleepless nights. This has been going on for 11 months without one day a break. And it's not about me. How about all the frontline healthcare workers that have been working around the clock, that are just stressed out to the max right now? Everyone is pitching in, and we're going to continue to work as a team, and we will get through this, and we will come out strong. We will create jobs. The economy will be booming, but we need that bridge. We need that bridge to get to April, May, and June. In the meantime, we're vaccinating the most vulnerable in our province, and we have a well-oiled machine when it comes to that. So we work as a team, and again, any mishaps, I'm wearing it.
Follow up?
And I know that you said you're doing everything possible, but Dr. Yaffe, if I can point to her remarks yesterday again, she came out in favor yesterday of paid sick leave. I know that you pointed to the federal COVID benefit, which is $450 a week. Do you think that's enough money for the minimum wage worker who has symptoms from stopping them from going to work? And do you think that's enough for most people who live paycheck to paycheck? And there's a growing consensus, it seems, as though proper paid sick leave is key to reducing case count. So why doesn't that happen? Why don't you listen to them when it comes to that?
Well, what we've agreed with the federal government, we aren't going to duplicate areas of support. We've spent billions and billions of dollars supporting families, supporting businesses, and we're going to continue to do that. They have that paid sick leave, which is very important. And we support them on that paid sick leave. So we're going to be there for the people in all different types of fashions, no matter if it's making sure that people can't be evicted from their homes, making sure that we give $200 to parents for every child that is in school. The electricity rates, we're keeping the electricity rates low. We're doing everything we can, and billions, not hundreds of millions, billions. Between ourselves, on top of that, the federal government, and we're going to continue supporting the people to get over the hump until we can get back on our feet.
Last question.
Your final question comes from Allison Martell with Reuters. Please go ahead.
Hi, Allison.
Premier Ford. Thank you. The federal illness benefit that you've referenced today runs out after 2 weeks. So let's imagine a parent who has to stay home for 1 week because their child was exposed to school, for a second week because they had a sore throat and got tested and were negative, and the third week they actually have COVID. What should they do then?
Well, great question. And we're going to work in conjunction with the federal government to make sure that continues the support that is needed. And again, we will be there, and I'm confident with the federal government, they'll be there as they have been right from day one with us. We're going to work together, and we're going to be there for the families. And I'm pretty sure, I can't speak for the federal government, but I'm pretty sure they're going to extend that.
Follow up?
What is the downside in mandating true paid sick leave, full income support so that everybody can afford to stay home? Can you help us understand the argument against this?
Well, again, there's the amount that the federal government is given that will get people over the hump for a couple of weeks. If it extends, there's the EI benefits. I had the phone call with the finance minister, deputy prime minister, trying to shorten that period from I think it's about 2-3 weeks for EI, and I want to shorten it down to a week or even 4 days for the sick pay as well. There's a tremendous amount of people that work, live paycheck by paycheck. I had that conversation with Chrystia Freeland just a few days ago, and saying whatever you can do to shorten that until we can help people so they won't have a period of a week or 2 weeks without income. And I have confidence in Chrystia that she will do everything she can to shorten that time frame until we can get money into people's pockets.
Thanks, everyone.
Thank you so much, everyone. Please stay home, save lives. Thank you.
Lots of breaking news from Queen's Park this afternoon. Let's send it over to Stephanie Smythe at the breaking news desk with the latest stats.
That's right, Lena. The Ontario government just issued a new state of emergency order and a raft of new restrictions as it works to combat this surge in COVID-19 infections that Premier Doug Ford says has put the healthcare system on the brink of collapse. So here is what you need to know. The new restrictions: all non-essential retail stores, including hardware stores, alcohol retailers, and those offering curbside pickup or delivery will not be allowed to open earlier than 7 a.m. or close after 8 p.m. Stores that primarily sell food, pharmacies, gas stations, convenience stores, and restaurants open for takeout or delivery will be exempted. Also, outdoor public gatherings and social gatherings of more than 5 people will be prohibited. So that's more than 5 people. Previously, up to 10 people were allowed to gather outdoors, and these will be enforced, these restrictions. And as the Solicitor General Sylvia Jones explained, with the stay-at-home orders along with the emergency declaration of the state of emergency, this empowers bylaw officers to go out there and to enforce these restrictions. The stay-at-home order is not a curfew. The Premier saying he hates curfews. He doesn't like anything about them. He doesn't want people being chased down by police if they're out at 8 p.m. at night. He says the stay-at-home requires everybody to comply with this, to be in order with what the province wants us to do. But they will be enforcing restrictions, and they could involve fines and even jail time. And he also, the Premier says he's going to come down on those big box stores like an 800-pound gorilla if they don't comply with the restrictions. Now, when it comes to schools, if you're wondering, schools in Toronto, Peel Region, York Region, and Hamilton, as well as Windsor-Essex, will not return in-person instruction until at least February the 10th. The Chief Medical Officer of Health will advise the Ministry of Education by January 20th on which public health units elsewhere in Southern Ontario are going to be allowed to resume in-person learning the following week. Now, students in grades 1 to 3 will now be required to wear masks, and the province is also expanding screening protocols and targeting testing at schools. Now, childcare centers for non-school age children will remain open. So all of this comes into effect on Thursday, January 14th at 12:01 a.m. So again, it is a stay-at-home order requiring everyone to stay at home with exceptions for essential purposes, such as going to the grocery store again or pharmacy, assessing healthcare services, for exercise, for essential work. Yes, the banks will be open. This order and any other new and existing public health restrictions, they say, are aimed at limiting our mobility and reducing the number of daily contacts with people outside of an immediate household. And again, in addition to limiting outings to essential trips, all businesses have to ensure that any employee who can work from home does work from home. We're going to go now to our Christina Tenalia, who is live at Queen's Park. You were just asking the Premier about that difference between a curfew and a stay-at-home order, Christina, and he was quite clear how he feels about curfews.
Yeah, Steph, he was. We know there are a lot of questions people have still. I'm getting so many questions right now. So the thing is, look, the message is pretty clear. The province wants you to stay home. Whether the province calls it a curfew or a stay-at-home order, it is formally a stay-at-home order. That means that the province is once again taking this seriously. I mean, the question I asked the Premier is, this has been the message all along. There have always been enforcement options. It has just been that at times police have chosen not to move forward with enforcement and ticket people who gather in groups. We have seen a number of cases where organizers of large events, including protests, actually even here on the lawn of Queen's Park recently, independent MPP Randy Hillier received a ticket for a fine of, I believe it was $750 for organizing a protest here. But the government is saying there will be more active enforcement, including the OPP, if you're out when you're not supposed to be. One of the questions I've been getting asked is, can you exercise? Yes, according to the documentation from the government. Again, I was still felt unclear after I asked the Premier as to how this will be enforced. I mean, you're out exercising, walking your dog, going to a medical appointment, going grocery shopping. I mean, there really is no way to prove that otherwise, even if you weren't, if you get, let's say, stopped by an officer. So it sounds like the government is doing what they can here, although these measures, make no mistake, have really always been in place, except as Solicitor General Jones noted, the push now is that the OPP will be moving forward with enforcement. Steph, if I can add one other thing, because I'm getting a lot of questions about this as well. So, of course, it was announced today that schools in those hotspot regions, Toronto, Peel, York, Windsor, Essex, and Hamilton, students in those regions, teachers, staff, and students will not be returning for in-class instruction until February the 10th. Now, we know that there are a number of special education instructors and their students who have been partaking in in-class instruction this whole time, despite schools being closed. So I've been asked, will in-class instruction continue for special ed students who are in those specific hotspot regions? The answer is yes, it will, for a small number of students whose needs require them to be in class for that kind of instruction. A couple other things. So in terms of store closures, 7 a.m. to 8 p.m., again, that doesn't include essential stores like grocery stores, only other places, like I think on the list, if I can pull it up here, hardware stores, for example. So these are the latest measures from the Premier, and also enacting once again a province-wide state of emergency. We have not been in a state of emergency officially since July of 2020. And it looks like, look, here in the province, as we heard from the latest modeling data, if things continue at this pace, we are on track by the end of February for 100 deaths a day. The province already got close to that last week with a record high, 89 deaths in a single day. Step back to you.
Okay, Christina, and just more about the enforcement measures. So under the state of emergency, with this declaration, the province will provide authority to all enforcement and provincial offences officers, including the OPP, local police forces, bylaw officers, and provincial workplace inspectors, to issue tickets to individuals who decide they will not comply with the stay-at-home orders, or those not wearing a mask or face covering indoors, as well as retail operators and companies who do not enforce. And those who decide not to abide by orders will be subject to set fines and or prosecution under both the Reopening Ontario Response to COVID-19 Act and another act that they mention here. So It's just, we are being warned that according to the Premier, they mean business when it comes to enforcing these new provincial orders in effect for 28 days. And, he again mentioned those big box stores. He's going to come down on them like an 800-pound gorilla if they don't comply. So we will be watched according to the Premier, and those orders in effect as of 12:01 a.m. on Thursday, January the 14th. Keep it here for more coverage of this breaking news. Back to you, Kate.
Okay, Steph, thanks so much.
Sorry.
That's okay. And these restrictions come on the same day provincial health officials release new modeling data projecting Ontario could reach 20 to 40,000 COVID-19 cases next month.
See there that really with case growth between 3 and 5%, that's the second and third line from the top. We're really pretty much exactly where France and the UK and the Netherlands are at the same point in their pandemic growth. And so we're facing the type of growth now that those jurisdictions have felt the need to take decisive action on to restrict. I won't get into the overall case numbers, safe to say that if we do hit the 5% level of growth, which is quite possible, we'll be looking at over 20,000 cases a day by the middle of February. And if we get into a darker situation with 7% growth, where actually we have seen some days of 7% growth, we'll be looking at over 40,000 cases per day.
In order to get what we call herd immunity, we probably need 60 to 70% of the general population vaccinated. That won't happen for many months. And so the variant is already here. We know it's, the data shows, as Dr. Brown indicated, it's probably at least 56% more transmissible. And at this point, as I said, 3 of our cases, we don't have a travel history. If that's confirmed, we have evidence then of community transmission, and that is a very serious concern that the vaccine will not be able to address quickly enough.
We also heard from Dr. Warner of Michael Garron Hospital ahead of the Premier's announcement.
The 5-day wait for the lockdown was inexcusable. I mean, lives are being lost because of this. And whatever the Premier announces at 1, it better be enough, because if it isn't enough, more people will die. We have to recognize that this isn't something that we can just kind of manage. We have to lock things down severely, support people so they don't have to go to work. And people like me should be the only ones on the road going to work. Everyone else should be at home unless they have a fundamentally essential role in society that we cannot be without. That's how bad this is. Anything less just won't be good enough.
Let's talk about today's numbers now. Ontario is reporting 2,903 new cases of the virus, including 8 new cases of the more infectious UK variant. That is down from 3,338 cases reported yesterday. 41 more virus-related deaths are being reported today, up from 29 deaths yesterday. 837 of the new cases are in Toronto, 545 are in Peel, and 249 are in York Region. More than 44,800 tests were processed. The province says nearly 11,500 doses of COVID-19 vaccines were administered in Ontario yesterday. More than 133,000 doses have been administered in Ontario so far. More than 6,000 people in the province have received 2 doses needed to complete the vaccination regimen. Prime Minister Justin Trudeau says Ottawa will buy millions of additional doses of Pfizer's COVID-19 vaccine.
I can announce that we have reached an agreement with Pfizer to buy an additional 20 million doses of their COVID-19 vaccine. From our agreements with Moderna and Pfizer alone, we will now have 80 million doses of COVID-19 vaccines arriving this year. We're on track to have every Canadian who wants a vaccine receive one by September.
I have not and will not withhold confirmed information concerning the delivery schedules of vaccines. What I will continue to do is provide concrete facts so that all involved can plan accordingly with as much certainty and confidence as can be provided in the current environment. Once we enter the second and third quarters, Canadians will see a dramatic acceleration in the pace of scheduled vaccine deliveries.
Moderna Moderna says its COVID-19 vaccine offers protection from the virus for a substantial amount of time. The company's chief medical officer says the vaccine's protection lasts for at least 1 year. It requires 2 doses to be given about a month apart. Further testing is being done to see if a third shot will result in an even longer period of protection. It is 2:18 now, -2. This is Toronto's breaking news. CP24 coming up after the break. We're going to check on traffic and your weather forecast. That's next. Stay with us.